Okay, it looks like we've got Jim on. We're just trying to figure out how to unmute him.
Unmuted.
You should be unmuted if you want to.
Yes, I unmuted myself. Can you hear me now?
Okay, Jim, thank you so much for joining us.
I got the message that I'm an official panelist now, so my audio is unmuted.
Excellent. Thank you. Sorry for the technical difficulties this morning. And thank you everybody for your patience. Let's get started. So good morning. My name is Cindy Laughlin. I'm with Jefferson County Business and Workforce. And we're joining us today for a conversation with Jim Rada. He's the Division Director of Environmental Health Services for Jefferson County Department of Public Health. As you all know, Jefferson County's stay-at-home order set to expire May. That means some businesses will be ready to reopen to the public in about a week. As we do so, it is extremely important that we take precautions to keep ourselves, our employees, and our customers safe. Jefferson County Public Health is working very hard to support us in these efforts. They're creating guidelines in collaboration with state and other public health organizations that'll keep us safe while we get back to business. Today, we'll talk to Jim Rada about his recommendations for safely reopening your businesses. We'd also like to hear your thoughts on how these guidelines and practices can be designed to keep us working safely. Please feel free to type your questions into the chat box. We'll get to as many questions as we can today. We have quite a few people on, so if we don't get all the questions, we'll try to get you answers after the session. We'll also be recording the session today so we can post it on our website. So Jim, thank you for being here today, and sorry again for the technical difficulties. In Jefferson County, we are so fortunate to have a Department of Public Health that's working side by side with us to support our community. So to help us understand the current situation in the county, we start by asking you for an update on what's happening with coronavirus cases in Jefferson County.
Hey, your voice is a little hard to hear, so I'm
sorry.
That's okay. I'll do my best to listen hard and respond as best I can. So other questions or if clarifications needed, let me know. In terms of current activity of coronavirus in Jefferson County, we continue to see a number of cases every day, and our case counts and our death counts continue to rise. To what extent that would control what we do for the next in terms of reopening the county, those decisions should be made later next week as we approach the end of this last extension of the stay-at-home orders. Dr. Johnson, along with his colleagues at the metropolitan Denver level of public health agencies, is closely monitoring the data on a day-to-day basis. They are collaborating closely in determining what is needed to continue to either extend stay at home or to move to the safer at home order. The goal, obviously all of our goals, is to eventually move to safer at home and hopefully in the months ahead to move more towards the old normal. Although we've all heard the term new normal recently, it's very likely things will not be the same as they ever were, at least for some extended period of time. So that's about what I can tell you at this point. Is our cases continue to appear across the metropolitan area and in Jefferson County. The number of deaths associated with coronavirus do continue to occur. The numbers may appear small, but they are significant. So we need to make sure that the ultimate goal is that we start to see a decline in the number of cases of corona that are identified, and that those the numbers consistently decrease. We recognize that's an ideal. And ideally, we'd love to see that decline over a 14-day period be consistent and be a constant trend. However, we do recognize that we may not get there before we really need to be talking about how to effectively, safely reopen the community, the business community. And so that's where a lot of the discussion is occurring right now is how do we go about doing that?
Thank you for that. So assuming that the May 8th date doesn't change, what are the timelines for businesses to reopen? Are there certain businesses that will reopen before others?
That hasn't yet to be determined at this point. I think we're monitoring what other communities are doing and how they are allowing their various business sectors, business types to open. Right now, our focus is really on trying to identify effective guidance for all types of business so that whatever opening dates may be assigned, that people are prepared to reopen their businesses safely, effectively, and in a way that protects not only them and their employees, but also the general public.
And is there a timeline for when those guidelines might be available to us?
We're actively working on those right now. We're working with members of the business community, primarily the West Metro Chamber and the Business and Workforce Center. But the West Metro Chamber has also indicated that they'll be pushing out information for input or question, hopefully early in the coming week. We're hoping to have a lot of the guidance drafted and looking to hopefully do a soft rollout on the health department's website of business guidance. As you can imagine, every health department in the metro area in the state and everyone's putting together guidance. So to make sure that we are being consistent, we're working across the metro area and working with communities and business groups from across the metro area to define what the guidance should look like and what is the most effective way of reopening various types of businesses.
Okay, thank you. Are there some standard safety practices that we should start thinking about for reopening our businesses that apply to a lot of different businesses?
Yeah, there are, and I probably won't be able to cite them all from memory at this point, but the general concepts are, how do we protect our employees? Some of the things that we're considering here is, when is masking necessary, or should it be necessary for everyone? What is the appropriate level of workforce that should be in your facility, whether it be an office setting or a business, some other type of business? What type of monitoring do we do of our employees to make sure that they're not coming to work sick, or that they're beginning to have symptoms of coronavirus that we could easily identify and not allow them into our businesses or our offices so that we don't create exposure situations. As far as protecting our customers, how do we look at social distancing, or how does social distancing work within various types of business, whether it be personal services or restaurants or factories or office settings, retail stores? How do we do that effectively? And that we're going to rely a lot upon the business community to identify what works the best to meet those kinds of social distancing requirements in their own businesses. There won't be, I don't anticipate that we in Jefferson County will be doing a lot of enforcement of those types of things. So it's really going to be incumbent on the businesses to be, if they feel that in order to protect themselves and their employees, that they need to require their customers and their employees to wear masks, then that we would rely upon the business operators to require that and do whatever is necessary in order to carry that out. So whether that means turning customers away or providing masks for customers to enter your business, we're going to have to figure all of that out. So. So those are just a few things that we're considering at this point. Um, and we need to work closely with the business community to develop that.
So this might be a great time for the business community. We have a great representation on this call right now to give us that insight into how they're looking at opening their business and some of the challenges that they're facing and maybe some of the solutions that they've considered. Let me ask a question from the chat from our participants. We have somebody who's a home-based business. This person teaches guitar, and just wondering how that works for a home-based business. It's he as well as a student that's going to be in the office together. They're not going to have other participants, but so do they just need to make sure that that 6-foot distance is maintained, or what recommendations would you have somebody operating a home-based business like that?
I think that I don't have a specific answer for that one, but I think the general guidance will be applicable to many different types of businesses, whether they're home-based or facility-based. I think, the idea that you want to maybe have your individual clients scheduled, that you perhaps screen them when they come into your home. Perhaps that if the weather's good, you do it outside, but maintain some social distancing, at least the minimum 6 foot, to be able to. And then if you feel like there's going to be potential for aerosol, from your breath or what have you, utilizing masks might be an appropriate thing, especially if we're doing vocalist work along with guitar work. I know in music lessons there's lots of discussion and talking, and teaching. So it might be good to wear masks. Making sure you have hand washing facilities available so that if there's a cough or a sneeze, or there's contact of some sort, that there's ability for folks to wash their hands, or at least have a hand sanitizer available so folks can utilize that when they enter into your home. Just some ideas.
So restaurants are probably one of the businesses that is feeling most challenged by this, trying to understand how they're going to open up safely and keep that social distance. We've heard the possibility of maybe removing some of the seating. You and I, Jim, were on a call yesterday where somebody came up with a concept of a plexiglass divider that's movable, and could maybe provide some of that separation even if people aren't 6 foot apart. Is the Department of Public Health looking at some of those innovative practices as ways to maybe allow businesses to have a little bit more density?
Again, an excellent question. As the first thing we need to be clear about is that the state health department is actually the primary regulatory body for retail food. So restaurants fall under that. We do the inspection work on behalf of the state health department. So we're going to rely on the guidance from the state health department to help us to work with our business operators to make sure they're doing things that are appropriate and safe. That said, I think there's lots of room in every type of business, including retail food, for innovation and ideas and creativity, and we really want to encourage businesses to be thoughtful about that. I don't know that there's any one single answer to the problem. The key is what we're trying to do is to avoid exposures in the public, and we all know now that you don't have to be sick to spread the disease. So, safety is going to involve separation, and error is not limited to a 6 foot space around a table. So if there are active cases allowed or in a facility, the more spacing, the better. That said, there may be some creative ways of addressing that, whether it be moving tables or rotating occupied tables, or really trying to figure out what's the best way to maximize your occupancy. I again am looking forward to receiving some greater guidance from the state on that particular topic as we move ahead with Safer at Home. And I know for certain that they are working with various retail food operations or the large associations to try to develop that type of guidance.
Now, have restaurants opened anywhere in the state? Or is that you're aware of?
Well, restaurants have been open since the beginning of stay at home, although they've been limited to delivery and takeout and so on. Where restaurants can do that, that's been the limitation. Yeah, I think the next step, obviously, is to how do we get people sitting back in restaurants, and how do we when do we begin to maximize or to increase the amount of occupancy allowed so folks can make money. Um, we understand that occupancy equates to earning in those facilities. So we want to make sure that that happens eventually. But we also, from the public health perspective, really need to ensure that whatever is done and the speed or pace that that's done at is done in a way that is maximally protective of public health. And so as much as we feel terrible for the industry and the impact of this epidemic on the industries all over the state and all over the world. We definitely need to continue to focus on how do we prevent the spread of this disease.
And what we've heard from businesses is even when they reopen, they want to make sure their customers are safe coming back. But that's a big concern. Our customers going to walk back in the doors. So knowing that we're putting all these precautions in place, I think is going to give people that confidence as they come back to our doors. We have a question from Adam. He is the owner of Meadow Creek Tennis Club in Lakewood. He's at an indoor-outdoor tennis and fitness facility, and he's looking for guidance regarding. Sorry, you're not hearing me well. I'm so sorry. He's looking for guidance. It helps to reach your ear over computer, but he's looking for guidance regarding the timing of reopening the indoor portion of their facility.
I can say that I've also been reviewing quite a bit of information from a whole lot of different recreation groups, and one in particular is the Eagle County and recreation reopening plan, which is I think was developed in part or in most part by Vail Valley and Eagle Vale and some of the other bigger players in that area. There are specific provisions in that, which is in that particular plan is being looked to somewhat of it as a model for the rest of the state. So if anyone has the ability to search for that plan, there are some specific requirements or some specific guidance, if you will, for tennis clubs and things like pickleball and other things, other types of sports like that. So I don't know that there's a timeline or there's anything I could tell you in terms of when things might happen. Again, applying the general requirements of separation, sanitation, hygiene. Those, how do you do that in your particular business is going to be really on the individual business operator or the facility operators. So, do we only, just as an example, in the Eagle Vale area, they're talking about, initially just allowing one pair singles games, and you have to stay separated, ensure social distancing, only one ball per person, and it has to have your name on it, and you have to have hand washing and or hand sanitizers available. And so it's not what you're used to doing, and it's gonna be tricky at best to enforce those types of requirements within your facility. But we also recognize the importance of recreation and exercise to health, and so it's going to be, kind of on the individual operations to follow what minimal guidance is out there and really try to implement those basic sanitation, hygiene, separation, infection control principles within your type of business.
We have a question about the requirements put forth by DORA and whether or not they supersede Jefferson County Public Health, your guidance. They're requiring, apparently DORA is requiring many of the things that you're mentioning as potential options. So they're actually requiring those things at this point.
I would think those things that are regulated by DORA are associated with some level of licensing or certifications that they issue. If they are saying that there are requirements or are regulation or are orders, then I would say they probably supersede what we're going to do. And if they are more stringent than what the state or local orders would require, then of course, I think they would supersede.
I'll ask you this question. I'm not sure you're going to have the answer necessarily, but I think it's an interesting question that I've heard debated on CNBC, and a lot of people are really wondering how this is going to impact businesses. And that is the issue of liability. If somebody comes to your business and they contract the virus, of course, it's hard to say that this is where they contracted it, but that's not to stop somebody from suing you. Are there any laws that you're aware of, or is anybody looking at this within the public health realm to make sure that businesses are taking the proper precautions, but they're not also burdened with lawsuits that may derail their business?
I knew there was a reason I did not go to law school. But I would defer the legal questions certainly to the individual's lawyers because they're going to be able to speak much greater to liability. One thing that we're trying to work with and get information out, or perhaps a tool out for business across Jefferson County, is something similar to what's being implemented in Broomfield and Boulder County, which is I think initially they were calling it a self-certification program. I think right now they're modifying the terminology, but basically it's a tool that's provided to businesses to with a somewhat of a checklist to walk down all the things that would be required or perhaps necessary for protection of that business. And I know that Rada mentioned yesterday in a meeting, the EDC, that they are using that type of an approach for businesses more as a marketing tool for businesses. But in essence, it seems to me that could become somewhat of a, I think with the business working with their legal counsel, could become somewhat of documentation that they are following what's required, and maybe be somewhat protective of those businesses. So we are also looking to develop that type of a checklist that would be available through our chambers across the county, as well as the health department, to help businesses kind of walk down a list of the things that they would need to do or have in place, whether it be, employee checks, customer checks, PPE, and all the way down that list to be the most protective they can be and limit the risk of their business creating a problem.
And then were they talking about some sort of a window decal or something, so customers could see that business has gone through the effort of taking on those precautions?
I think that Arvada was talking about a decal. Some folks are talking about a poster. Some communities are, once the individual has filled out a poster, it gets submitted to the city, but then, or filled out the checklist, it gets sent into the city. It automatically sends back an email that says you're certified by the city or what. what have you. So there's going to be, I think, a variety of different approaches to that. But the bottom line is we all want to um, get you all the information that you need and the tools that you need to be able to inform your customer base that you're doing everything you can to protect them as well as your employees.
We have a question from a property manager, and he's wondering if there's going to be provided once the guidance is issued that covers common areas, entrance doors, elevators, restrooms, things like that.
I would not doubt that. There's going to be guidance on a whole lot of different things. Undoubtedly, as more issues arise or questions arise, then there'll be more eyes and minds being put to creating appropriate guidance. As far as common areas within housing, I think what's important there is that people aren't hopefully congregating. If they are, then the property managers should be discouraging congregating. Um, with the Safer at Home, it does talk about groups no larger than 10. So there may be some allowance for small, groups to get together, but then it also talks about social distancing and really enforcing the social distancing. So common areas may not be large enough to handle groups and achieve the social distancing needs. The other part of it is the sanitation end of it, and how frequently should things be disinfected, and what should be disinfected, and essentially, the best thing we can advise at this point is that property managers up their disinfection, their sanitation programs, and really watch what goes on in their common areas on a day-to-day basis, and then several times a day go in there with improved disinfectant and clean those areas thoroughly. If they're being heavily used, you should be probably disinfecting more frequently. If they're not, then maybe daily is adequate. But really focusing on the surfaces that people's hands touch, that might be exposed to coughing or sneezing, those types of things. You don't have to do the big fog, I don't think, that we see a lot of on TV, especially from other countries where guys in white suits go around spraying everything with chemicals. I think the important thing is we know that this virus is transmitted through close contact and droplets, aerosols and droplets from our mouths and noses. So, consider areas that would be mostly in contact with hands and potentially exposed to droplets from sneezing and coughing.
Can I just say that this is a germaphone's dream come true? And it sounds like janitorial companies will be doing some hiring soon. Are you envisioning us having to take the temperatures of our employees as they walk in our doors? Do you think that's going to be part of the guidance?
I think that will be to some extent, particularly for larger businesses where you have more employees. Smaller businesses, it may be more where you ask employees to self report. And maybe if you have the appropriate types of thermometers and you can manage them, the sanitation end of it, it may be wise of you to check temperatures at least when folks arrive, just so that if somebody arrives with 102 fever, that you want to turn them around and send them home and help them to contact a doctor or a medical provider so that they can be tested or at least examined to ensure that they're not spreading something in your business.
Are you envisioning us having to take temperatures or somehow screen our customers as they walk in our doors?
Again, I think there might be some level of that, depending on the type of business. I know I've read some guidance out there that does encourage business to ask their customers if they've had any, in particular, personal care businesses like salons, massage, other body art, things like that. because you're going to be working closely with those individuals. And so it may be very prudent of you to be asking your clients or screen your clients when they arrive, or prior to coming in, have them submit some sort of a screening, self-screening. I think more I want to be as consistent as I can, but I think it's really going to be upon you to um, depending on what you do for business, to dig a little deeper into the health conditions of your clientele.
So I know that Jefferson County is working on guidance. Is there any guidance available right now that businesses can look to give them, because we are looking at businesses potentially opening next Saturday, right? That May 9th would be the opening date. Is there something published either by the state or federal government that could give them some of that guidance until Jefferson County is able to release that information?
Absolutely, and I think I would direct folks to the state's Safer at Home website. And on that website, you'll have to do a little bit of searching, but there are pages and pages of guidance for various types of business. There's also the general health and sanitation and hygiene guidance there. Much of what we're developing at the metro local public health level will be based upon that guidance. So if folks are interested in exploring that now and beginning to plan for reopening, we would definitely encourage them to review that website and consider what parts of that would apply to their businesses and begin obtaining whatever supplies they need and or making any changes to their facilities, at least considering what they're going to need to do to achieve the social distancing requirements.
So speaking of those supplies, we know that some businesses are still having a hard time getting masks and hand sanitizer, things like that. This could potentially prevent somebody from opening. Any thoughts on where we could get some or when the supply might be available to us again?
That's a $64 million question. Probably $64 billion, actually. I don't have a response to that other than I went to King Soopers yesterday and there wasn't a paper towel on the shelf. There wasn't any disinfectants. There was, so not only do businesses have issues, but in obtaining that material, but individuals do also. I don't have a good answer for you on that one right now. I know that our emergency operations center is looking at how do we find that material and procure that material, and how then do we distribute it in the community to not only protect our first responders and but also help our businesses. So I believe there is money coming to the state, also from the federal government, and that's getting distributed to various communities. I don't know if any of that will be available for businesses, but it's not the money so much as the equipment or items itself, materials themselves. And I don't know what the availability will be now or into the future, but yeah, it's going to be challenging for certain.
One of our staff was able to get some masks yesterday at Target, so everybody run out to Target right now. So somebody is asking about OSHA guidelines. Do you know if there have been any OSHA guidelines issued recently?
I don't know how recent they are, but I believe on the state's Safer at Home website, I think there is a reference to OSHA guidance, if not OSHA regulations. So I would again push people towards either the state Safer at Home website or to OSHA coronavirus. I think that there's probably a direct link to information about that there.
Thank you. So we're at our time limit. We did start a few minutes late, so if people could stay with us another 5 minutes. Jim, do you have another 5 minutes to stay with us? Sure. Okay, excellent. Thank you. So I wanted to give our businesses a chance to offer their suggestions, their thoughts on things that maybe you're thinking about doing that you want Public Health to consider as they develop the guidelines. So go ahead and offer that information in the chat if you have any thoughts, and we'll share that information. So Jim, I did have, while we're waiting for that, I did have a question from a salon owner. She's got people working in different rooms of a house. So even though they're not necessarily 6 feet apart, they're separated by hard walls. Do you see any concerns with social distancing? Can she have more than 10 people in her business as long as there's that hard separation?
I don't know about the 10. I think the separation is probably good. I don't know about the number because that may become a part of the next level of orders. I just don't have an answer to that, but I do, I think hard walls will definitely help. However, folks will continue to interact within the business, perhaps just in passing or in a break room or a lunch room or a kitchen. And so that's the types of interactions that we want to maintain social distancing. Or I can tell you in our office is we're thinking about how do we do it because we're full of cubicles, and how do we manage our staff to keep social distancing. And so we're looking at the requirement potentially of 50% or less of our staff being in the building, and then separating, maybe having rotating or setting up our schedule such that we have empty cubes in between employees at all times. We don't really know exactly how it's all going to work out, and the bigger the organization you have, the harder it is to do that. But the more, again, I can't emphasize enough, the idea here is to avoid exposure. And that happens through, testing your employees or monitoring their health, sending them home if they're sick, not allowing them into your facility to begin with. And then, depending on the level of interaction they have with each other or with your customers, making sure that they have the necessary PPE, that there's hand washing available so that folks can wash their hands as frequently as possible, masking if necessary, or face coverings of some sort. All of those things are going to add to the potential of reducing exposure. And that's where we then begin to have less and less cases. We have less and less contacts to monitor. We have less and less testing to do. And eventually, months and months down the road, we will hopefully be back as close to the old normal as the new normal will allow.
We'll have a vaccine.
That would be awesome.
I have a question about masks. Other than the medical grade masks, are the homemade masks pretty much equal? Does it matter if I bought my mask at Target, a disposable mask at Target, or if I'm just putting a bandana over my face? Are they pretty similar in their effectiveness?
That's a very good question. We just had Dr. Johnson has been actually studying that quite extensively because we believe those questions are going to be very important in the next phases of our control plans. And what we're seeing and what we're understanding the research to show is that just general face coverings, may not be as effective, probably are not as effective as medical masks, or certainly not as effective as the N95, very protective ones that we're trying to reserve for our first responders and medical personnel. Bandanas and other homemade types of cloth masks, they will do the job of eliminating large droplets or capturing large droplets. There's some science to indicate that perhaps they aren't as effective at fine aerosols that might be created during a sneeze or a cough. That's why it's still going to be important to use your elbow, cough into your elbow or sneeze into your elbow, because that will help, again, reduce the amount of aerosols that leave. We're going to be really looking closely at, I know the city of Denver has implemented a mandatory facial covering requirement. I find that that would be very, very difficult to enforce. But if the more that we can work with, messaging in the media, the more that we can encourage our business operators and other organizations to encourage their staff to use masks, encourage your customers to use masks. The more that we normalize that kind of behavior, hopefully, the more people will understand that it's not about just me, it's about you. For one thing, I'm working to protect you or all the people that I'm around. But it hopefully, overall reduces the amount of exposure in the community and begins to help with knocking down the numbers of cases we have.
You know, I think what we learned from this is it's really all about all of us. There's no one solution that's going to work for everything, for every situation. We all have a part in making sure that once our business is open, they can stay open. I would certainly hate to have that, the euphoria of seeing the restaurant stores open and then have to close again. So I think we all have a huge role to play in that. Any last thoughts as we wrap up that you want to share with the community?
I just echo what you just said, and I really believe that um, business community, we don't want to be heavy-handed. I don't think there's a need to be heavy-handed. I think we want to work hand in hand as close as maybe we have to wear surgical gloves for that, but we want to work hand in hand with our business community to come up with the best solutions. Um, we'd like to avoid having to do enforcement of orders. We think that the community deserves the most effective means of controlling this disease possible, and a lot of that rests with you, with the community. The general public, sometimes it's hard for them to take what government says seriously. Sometimes they want to resist government. We face that pretty frequently in government work. But the fact of the matter here is it's not about government versus business or government versus people. As the cliche has been going, we're all in this together, and we need to really unite around trying to eliminate exposure in the community, whether it's through more testing so that we can identify folks who are infectious, more contact tracing that goes along with the testing, or just the simple thing of wearing masks and washing hands and really doing what we can to keep ourselves separated.
Thank you, Jim. If people have questions, because there are several questions we weren't able to get to today, how do you recommend that they seek answers from Jefferson County Public Health?
That's, you tricked me on that one. I wasn't ready. I think.
Is there going to be, so that once the guidance is issued, will that be available on the website, or where can they go to find that information once it's issued?
I anticipate that by mid next week we will be rolling out what guidance we've been able to create and what tools, posters, signage, things like that we've been able to create. As I mentioned, we're working very closely with the chambers, so your chambers will likely be sharing the same information, and it may be through the chambers and branded by the chambers, but our work with them is really about putting out consistent, accurate information. Certainly, I believe there's a contact line at the health department that's been set up that you can leave messages now. I really I'm resistant to giving out email addresses because we're all being inundated by email. So I think the best way is to really go to the county or the health department's website, put in your request for information or questions. We'll do our best to respond to you as quickly as possible, but please understand that everyone at the health department is inundated right now, and it may take some time. And then maybe we can work with chambers and that to create a kind of common request or information line. So.
Great, thank you. And we will be posting those guidelines on the Jefferson County Business and Workforce site as well. So you can check our website. All right, thank you. We're over by 10 minutes. So thank you so much for being here today, Jim. I appreciate all the work that you and Public Health Department are doing for our community. And thank you to all participants today. We appreciate you being on here. You've got my contact information. It's NLAUGHLI@jeffco.us. If anybody who's on this call has questions, we will look at the questions that were not answered today in the chat and respond to those as best as we can. But if you have any other questions or comments, please feel free to reach out. Thank you so much. And it's Friday, so enjoy your day and enjoy the weekend.
Bye now.
Bye.
Thank you.
Bless you.
Oh, sorry. Didn't realize I was still online. It's allergies. It's not COVID. Have a nice day.
Thanks. You too.
Bye.